So thank you everyone for joining tonight and taking the time out of your schedules to be with us. My name's Dr. Kim Omond. I'm a board director for GPRA, and I'll be presenting on GP training, employment and the NTCR tonight. So firstly, acknowledging that we're on Indigenous land. So specifically myself, I'm on Kaurna country, which is Adelaide, so right down the bottom there for anyone who's not familiar with that, and acknowledging any Indigenous people who are attending tonight. Moving forward. So as I said, my name's Kim Omond. I'm an Adelaide-based GP, fellowed last year, board director with GPRA. I've had various roles in the last couple of years representing general practice and registrar peers. Particularly the RLO role, a registrar liaison role, was one of the ones that started this, and other roles snowballed or really came from that. RLOs, for anyone who hasn't heard of them, are in each state. So each college has a representative RLO for each state, and they sit on our advisory council for GPRA. A register advisor, are sometimes abbreviated to RA. They work for GPRA. We're lucky enough as well to have Phil on with us tonight. So I might just throw it to you briefly, Phil, just to give a hello and a quick intro as to about what a registrar advisor does.
Yeah, absolutely. Thanks so much, Kim. So my name is Phil. I'm one of the current GPRA registrar advisors. I'm available by email to all members. Membership is free, so if you're not already a member, please sign up. I provide advice by email and sometimes by phone to all registrars, whether it doesn't matter what training program you're on. And it's often surrounding sort of employment conditions, workload, and a whole lot of the subjects that Kim is about to dive into. So if you have any queries, feel free to put them in the chat during this meeting, and I will cover those at the end. And otherwise, I'll see you in my inbox sometime soon. Thanks a lot, Kim.
Beautiful. Thanks heaps, Phil. And yeah, just like Phil said, pop any queries that you have tonight in the chat. We won't be responding to very individual sided queries. They're better taken through us at GPRA. So the email there, inquiries@gpra.org.au. So anything specifically individual, it's a better way to get in contact with us that way. But anything more generic, burning questions and that side of way, absolutely pop them in the chat, and we'll have a bit more time for questions as well afterwards. So tonight we'll be going through who is GPRA, what we do, and then talking about the placement process and employment conditions for general practice and rural generalism. So GPRA, we are the only national impartial advisor for future GPs in training. So we are college agnostic, so meaning we support both colleges. We don't preference either college. We're about all registrars training on whatever pathway to be specialist GPs in Australia. We do a lot of things. So we support our members firstly by negotiating the national terms and conditions for the employment of registrars. So that's the NTCR, which you'll hear more about tonight, and that sets the minimum, so keyword minimum terms for employment. Then we do a lot of advocacy in space for education, training, employment policy issues. So the employment space is really our key, and that's where general practice is a bit different, as some of you might have already experienced, compared to the hospital network, where you're employed by a bigger organisation like Queensland Health or SA Health. In general practice, while the colleges support the training and do an excellent job with delivering their training, the employment is through an individual GP clinic generally, and so there can be a bit of a different nuance with your contracts there, and that's where we really come in to support our registrars there. We have a lot of education events. Daniel has done an excellent job with providing a lot of the excellent quality on our website as well from there. In addition to those side of things, There's a lot of other things that come with our membership. So there's various access to some AI scribes, which again, depending on whether you're training, you may be able to use them or not. Access to some other education events, both internally and externally through GPRA. And this is a QR code for our membership here to sign up. To get in contact with us, you need to be a member, but it's very easy to join, free to join if you're not sure. So some people may have joined up within med school, can't quite remember, just join again. We match that side of things up if there's ever a double record of someone. So just an overview of pathways, because there's a lot of acronyms and talk within this side of space. It is a bit complex, but just to give you a bit of an idea, a lot of training in Australia happens under the AGPT, which is the Australian General Practice Training Pathway. This is funded by the Commonwealth Government, and it's got pathways with the RSEGP, ACRM, and the RVTS, which is the Remote Vocational Training Scheme. Some of you may have heard that. That's where registrars are in the same practice throughout the entirety of their training, and supervision is in a remote side of model, but very supportive. Then there's the Rural Generalist Training Scheme that will be consolidated under the AGPT from next year. A single employer model, that's where rather than being employed by the individual GP clinic, you're often employed by the local health network, not available everywhere. One of the examples in South Australia is the RACE program. And then there's also the Fellowship Support Program, or FSP, and that's a self-funded or independent path training. And you'll notice here that the NTCER sits within all of these, apart from the same in Queensland, but can be applied to all aspects of training for all registrars, really, in general practice or RG. There's a lot to this side of space. Regardless of what college you're on, you go through an application process. As part of this process, you'll likely need to prepare a resume and participate in an interview. Time frames for this will be communicated by your college and your training coordinators. There's 2 intakes a year. It's administered by both colleges and also the RVTS, and you apply directly to them. If you're doing that in that process, there's also information on our website about that as well. We'll talk about this more going forward. So for those who are out to find a practice, it can often be a bit overwhelming, and it's the where do I start side of way, what's going to be the best fit for me. So we'll talk a bit to that tonight. One of the things initially to look at is do a bit of research on the practices in your area that you're likely to apply for. So have a look on their Google and have a look on their websites. So any details that you can see of the GPs working there to get a bit of a feel. Do they have any nurses or any allied health or visiting non-GP specialists there? What's the billing structure of the practice? Interesting as well, the demographics, where the practice sits. So for an example, when I worked in more of a rural location as a registrar, I saw a lot of older people, chronic disease. When I worked more in the metro side of things, younger people, a lot of women's health, a lot more pregnancy side of care. And then out of metro, it was a bit of in between. So everywhere is going to have a different demographic based on the people that it serves. When applying for a training placement, you'll need to prepare a resume and a CV. Similar to a cover letter, you want to keep these very clear and concise. So practices you think you're going to be inundated sometimes with multiple people applying. So think about what's going to make yours succinct but stand out. So you don't want to be, as a practice, reading through 7 pages of someone's resume or CV, no more than 2 or 3 pages at once. Tailor it as well for where you're applying for. So think about what it is about that practice that you're really keen for. The CV, the cover letter is really where you sell this. Why should they employ you? And prepare in that side of way to interview in that side of practice. Interviews, most people hate interviews, but in general practice, unlike the hospital area, it's as much of an interview often for the practice as it is for yourself, because it's got to be the right fit for both of you, because often it's a smaller business compared to the hospital where it's small fish, very big pond. Think about why you want to work there, what are your strengths and weaknesses, some other side of questions that might come up, how have you dealt with a difficult patient or difficult situation, how and when you've made a mistake. Some of the very typical interview questions may come up, but I was often surprised in some of the interviews about how much of more of a chat and a get to know you that it was compared to some of the more formal hospital interviews, but every practice is going to be different, so prepare appropriately for it. Always confirm what you need to provide for your application and do exactly just that. So don't submit an application missing a cover letter. Always personalise, as I said before. So while you might be applying for many different practices, don't make the practice feel like you've just cut and paste. It's a really bad look if you're applying for practice A, but you've got practice B's details on that side of things. As I said, cover letter, keep it brief. This resume, think 2 to 3 pages. Cover letter, no more than 1 page. Keep it specific, exactly what you're applying for and why they should hire you. So getting on then to employment in general practice. Firstly, because this is quite different compared to the hospital, so I just thought I'd speak to how people actually get paid in general practice. So it's a very different arrangement. So as a registrar, you are an employee. So you're employed by the clinic until fellowship, and the NTCR outlines your minimum terms for this employment. You could also be a salaried doctor. So it's similar to being in the hospital, you're a salaried doctor from there. There's also the single employer model, as we alluded to before, and unlike being employed by the clinic, you're employed by the state health system end to end, and the award is equivalent to your hospital equivalent. Then when you fellow, a lot of GPs are employed as a tenant GP, independent contractor, some of the language you might hear previously. And this is as a sole trader where you've got an ABN. And it's kind of in a way like renting a room at a practice. So, for example, I'd get 100% of my billings, but then I'd pay the practice a service fee for their services that they're providing me through having the room, the admin support, nursing support from there. But that's once you've fellowed, not while you're a registrar. The NTCR, as we said, this is the minimum terms and conditions for the employment of GPs at registrars and rural generalist registrars. Every 2 years, we negotiate this with GPSA, so that's General Practice Supervisors Australia, and this covers the working hours, education, supervision, remuneration, and dispute resolution as well. It's important to know that the NTCR is the minimum terms. You can negotiate higher depending on what your practice is able to offer you as well. While it's not an award, it's a set of mandatory, nationally consistent, agreed terms that are, as we said in the previous slide, applicable across all pathways apart from SEM in Queensland. From a registrar point of view, the way registrars get paid is a bit different. So you've got the base rate there, and that's there because there'll be times where you're taken out of your practice, so you're not billing as much because you're attending important things such as your education with your college. So your base rate is there as a safety net. So you either get your base rate or a percentage of billings, depending on what is higher. Then there's these things called SIPs and PIPs. It's not the idea of tonight to go into them. They're a bit more complex, often under, or at the moment still under a bit of a review. The idea is to know that they're there and have a discussion as well if it comes up with your practice about them. Then you get super on top of this from there. The other thing to be aware of as well is from 2026.1, so the start of next year, there's also an incentive for GP trainees of 30 grand for coming into general practice, and paternity leave, study leave as well. The NTCR as we said, it covers a number of things. So remuneration, so your base rates, and that, as I mentioned as well, there's that 30 grand incentive for new GPT ones from next year. It also talks further to the other payments as a SIPs and PIPs, the specifics of annual leave, education release, and study and parental leave. So it's a good one to have a read through, especially those main sections, but before starting on this side of process, but we'll talk to a bit more of it tonight. So common queries that we get. Often I found it was around annual leave. So what this means in general practice as a registrar is you get 4 weeks per year pro rata. So meaning if you're half time, so 0.5, it's 2 weeks per year from there. And this can be taken in advance. So meaning that unlike unlike small businesses where you have to accrue leave, you can take leave with negotiation with the practice before you've actually accrued that leave. If you don't take your leave, it must be paid out at the end of a training semester if you've got a 6-month placement. And if you're moving between practices, your leave does not follow you because you've got 2 different employment contracts from there. Admin time's another one that we get common questions on. It's basically half an hour a session typically being 3 to 4 hours, like a morning or afternoon block of work. And there's specifics on overtime and after hours as well. Cool. Moving on to the next bit. Working hours conditions is also really good to suss out with the practice, because while you might have an ideal in your head of what suits you, while a lot of practices will try to very well be accommodating, they've got other challenges on their side of things too. So for example, if a practice can only take a part-time registrar, they might only have specific days that registrar can work. So nutting out this side of things at an interview can also be useful as well. So particularly if the practice has got multiple locations, what's the breakup of that? How are you expected to be between both sites? How does the technology marry up as well? Is there any expectation for after hours or nursing home or on-call work? And if there's nursing home work, worthwhile as well having a conversation about what this works on the ground. It can be a lot if you're expected to see your list, respond to calls from the nursing home and then go to the nursing home after your list, compared to is there a week blocked off and that is just the week that you're looking after the nursing home residents. So there's a big difference within the admin side of structure from there, and you really need those admin processes and practice supports to help you in that, especially when you're getting going from that. Equipment's always a good conversation to have as well, just to clarify that before getting and going. And in particular too, if there's any annual leave dates that you've got in mind, especially if they're up front earlier on in the term, important, I'd even do it at interview, having a conversation up front about that, because practices just like to be organised. So it's not, they know you're going to take annual leave at some point during the term, as showing that you've thought about it, having that side of discussion. In my experience, a lot of practices have much preferred that compared to then if you start and then on day one you're saying, oh, by the way, next week I'm having 3 weeks off, please. Work with them from there. And on the working hours conditions too, this is difference which will come into key people towards the end. This is more in the practice manager side of realm. So practice manager works with the day-to-day runnings of the practice. Your supervisor, while they may or may not also be the clinic owner, the supervisor, education, medicine. From there, they often, depending on the structure of the practice, there's a different role to the practice manager. So the practice manager is also a person who's really important to have a good relationship with. I found it interesting when I worked as a registrar advisor, where people had contacted us and there were queries where things just weren't working out at the practice. There'd been miscommunications that had then got out of control. And I found it astounding sometimes about how many people just hadn't had a conversation early on with a practice manager about it. That often a face-to-face conversation in an open relationship where you can talk about, hey, by the way, I had 3 people booked in for 15 minutes. It wasn't working for me. What can we do so that makes sure the admin team work with me so I can see patients accordingly? Whatever the issue be, an early conversation in person often stops issues from snowballing. Has that also been your experience, Phil?
Yeah, absolutely. And I think that the practice manager is so key. And I suppose something it's a bit of a delicate relationship. I think coming from the hospital system, there's often quite a clear distinction between medical staff and non-medical staff. And except for maybe talking to the people who make the rosters every now and again, you don't have a huge amount to do maybe with the non-medical staff in the hospital system. Whereas the practice manager is a non-clinical person, but they are your manager. They are the person who looks after you.
And partly remuneration, it's really making sure that your employment and your contract is in line with the minimum conditions outlined in the NTCR. That yes, you can always try to negotiate above that, but it's very dependent on what the practice is able to offer as well. Yeah. And then I'd also, wherever possible, speak to the current registrar who's working there. Again, with the caveat that not every practice is going to be the right fit for the right registrar. So that's where take any feedback with a bit of salt. But you'll often hear different information from registrars as a different view who's worked in that compared to other side of people who work in the practice as well. Alrighty, so interviews and how to approach them. So there's a lot in this side of space when it comes to GP training and practices because it's such a different environment compared to the hospital. And unlike the hospital as well, you've got a key supervisor where compared to where you're head of unit, where you may have seen them once, if that, there's a different relationship with someone who's one of their roles within the practice is there to support and teach you. So that relationship with your supervisor is really key. So you want to know when your education is going to be built in and ensure it's locked out is one of the things to check that's happening. When's your mandatory teaching time? When you have questions in practice, how do you ask them? When I've done ECT visits, it's a bit of a yellow flag for me when some of the registrars haven't been able to get help in a timely way and kind of stand in a corridor waiting for someone to open their door to ask a question. That you need to have good processes to be able to get good advice in a timely when you're in this training side of capacity. And then it's also within the practice itself that while, yes, you get your mandatory days and education that's funded under the AGPT, it's also the practice itself. So it can be worthwhile knowing and discussing, does the practice hold any journal clubs or other side of education aspects? Or are the doctors in the practice also happy to answer questions? What's that side of teaching approach for the practice? And then do you have any particular learning goals within that side of practice? If, for example, skin excisions, is there someone who can help you there with upskilling? If there are any doctors who are doing marinas, are you able to observe in that area as well? If there's any particular areas you could learn from, and particularly any other supports that you need from a skill-wise too, that what's the makeup from an education perspective of the practice to give you the best possible training experience. Then the culture. I think I've heard lots of things about culture, but I think at the end of the day, it's something that you feel. So when you walk into the practice, what's the general vibe? Is this somewhere that you could see yourself working? The retention rate of past registrars is not a perfect meter for that, but it can also be a meter for a good practice as well, where people who've worked there previously have come back to work there when they've been fellowed. And again, similarly for the turnover of other staff, like nurses and admin, that while there is naturally a changeover of staff in any side of business, how quickly is this happening? So of course, practices at different times will go through different patches, but how long have some of the people worked in the practice for? Do they enjoy what they do? What's the culture of the place like? Are there any additional side of things like social footy tipping? What's good about this place that gives you that side of feel of this is a good general practice that's going to be supportive with a good culture? Workflow is another thing to consider. And this is more about the day-to-day runnings of how it works. So what are the process for checking results when you're away on leave? Is there a buddy system? Is there a remote access? A lot of the practices will have approaches to these, but it's a good thing just to learn and talk about it. So that way you also know how different things work in different places and what's going to be the approach for you. So even scheduling patients, that a lot of practices now have things online. It's an extra headache sometimes to not have online systems, with general practice being really at the forefront with a lot of the digital health approaches. But then it's also nursing support. So are you expected to do, for example, child immunisations by yourself or care plans by yourself? Or is there nursing support and workflows for that? And then the software that the practice uses, so a practice, what's their view on AI scribes or other digital health options, noting that it's not recommended to use this in GPT-1. But there's, again, every practice has got a different approach to this, so worthwhile having a conversation to see what this side of things also like. So just some take-home points from here. So NTCR is your friend, and you should, again, have a read or at least refer back to some of the key points on this slide before your interviews from there. At a minimum, while you can negotiate your base rates and billings, the practices do not have to offer you above that. Think as well, they are small businesses and have also got to pay you super on top of your billings too. So a lot of practices don't actually have a lot of wiggle room, do operate on tighter margins than what you'd expect. At a minimum though, you must be paid in monthly pay cycles. So every month your billings must happen from there. You must receive a payslip and have visibility over your MBS billings. Good one to always check as well with your practice manager or who is giving you the orientation about this and how to do it. Because I know at some practices when I started, I didn't initially have access to it, but it was purely just because a button hadn't been clicked on the system on their end, because different softwares will have different levels of visibility and accessibility, that sometimes it's purely just a box hasn't been ticked. So make sure you can see how you do it and or you know how to do it, and you do that at the end of each day as well. It's an important way to learn. Super is paid on top of your base rate or percentage of billings and receipts. Right. Finally, and we alluded to this before, but it can be a bit to get your head around with the different people who are involved. So some key people to know is you've got your college training coordinators. These people will help you through your training requirements, your placement process. Hopefully, if you're on training and about to apply to practices, you've already heard from them. Medical educators, again, a huge source of support for training, as often small group teaching, and another excellent source of mentorship of outside the college as well. So outside the practice rather as well. So it's a different line of support. Your supervisor is your in-practice teaching and mentorship. They may or may not be the practice owner. Practice manager we've spoken a good about before. RLOs, so registrar liaison officers. As we said, each state and college should have representatives, and they also sit on the GPRA National Advisory Council, which meets twice a year. So feedback, again, we always want to hear from you. The RLOs are an excellent way of feeding this back to, because then we hear the voices from everyone across the states. It's a really great grassroots approach up to help support for GP training. Other faculties to be aware of is the GPs in training. So that's more internal college advocacy that both the RACGP and ACRM have. And then our registrar advisors. Any issues, inquiries, whether it's about practice requirements, nuances of work, how the NTCR applies to your situation, any peer support or any challenges that you feel that you'd just like a second opinion on, do not hesitate to get in contact with us. A bit of a disclaimer though, we cannot do a contract read through. We are not lawyers. So while we can absolutely talk to the NTCR, we cannot do a full contract review for registrars. Your MDOs, though, are someone, if you're feeling like you really do need that side of support, have that legal option from there as well. But absolutely get in contact with us if there's issues around the NTCR or how that's playing out in your practice from there. And finally, just a comment as well that we spoke about the different ways that GPs can get paid, but just the actual, I suppose it's just the awesomeness of general practice itself, that I know I'm probably preaching to the converted here because you're all here on the webinar tonight, but it's such a diverse career in what it can offer that it really is a choose your own adventure in how you'd like to structure your work. And this can not only be but where you work, the groups of patients that you see, how you work, but the diversity of both clinical and non-clinical roles. So I can't really think of anywhere else in medicine where I could have the autonomy that I've had over my career with working in general practice clinically when I'd like to, supplementing that with medical education, with research, with board roles like with GPRA, that there's such a scope to carve out what you'd like to do. At times it can feel equally awesome and overwhelming, but it's just knowing that there's that scope there as well. So it's just a really exciting journey to start on from there.